It is impossible to truly measure the impact that Valentín Fuster has had on the field of cardiology.
Mount Sinai has given him the freedom to not kind of stay within the walls of the hospital and the research institution, but to actually go develop projects all around the world. They have given him the freedom to take what they've developed and learned at Mount Sinai and bring it around the world to help other people.
I learned from the very beginning in my life that we have to listen to other people. How can I speak about preventing cardiovascular disease in the United States when we have to learn how to prevent it globally? My view of global health is we are all together. One of my main objectives is to really do something in cardiovascular disease that is global. We are not isolated, and we are obliged to do what we can. Colombia was the first country that I was really involved, and this was the reason why I ended up working with children. I learned that it's nice to talk about prevention. It's very nice to go around and saying what should be done, but what is being done? And I reached the conclusion that the main issue is education. The people who are more prone to be educated are children.
Dr. Fuster engaged in conversations with Sesame Street to start a project here in Colombia, South America, called Healthy Habits for Life.
Puedes comer una manzana. Oh.
And it was a project that focused on promoting healthy habits in young children starting in early childhood, ages 3 to 6. There was a kind of a marriage between Dr. Fuster's vision of science and Sesame Street's vision of storytelling and engagement. And the project had the objective of really changing health-related behaviors through a school-based intervention.
¿Qué crees que es importante? ¿Qué comes tú?
Ensalada.
I think the impact that Dr. Fuster is having in Colombia through healthy habits that he's instilling in young people is really important for the country going forward.
Es al tiempo, a ver.
Gracias, amiguita.
Gracias, amiguita vaca. Muy bien.
We have an incredible potential to change society in young people. This is the future. There's no question for discussion. In terms of promoting health globally, you always have to start very humble, very small. And if it works, you go higher.
The results were fascinating and very positive. So it's then when we moved to Madrid.
Marco, ¿tú qué emoción trabajaste?
Contento.
Contento.
I think it's important to answer a question. Is the teaching to a child sufficient to change the culture of health? And it's not. You have to get into the families.
The Familia Project tested the hypothesis that a health promotion intervention targeting a vulnerable population in children and adolescents and their families was going to be effective as means of improving healthy lifestyles and the health of this population.
So how can we work on a family in which the children listen and the parents do not? If they get engaged, we will succeed.
Dr. Fuster approached us to be part of this project, that we were enchanted with the whole idea to expand our knowledge and understanding of this so very important aspect of the cardiovascular illnesses, disease, and conditions. The neighborhood that we serve, Harlem, they have a great incidence of cardiovascular illnesses, conditions, diabetes, obesity, and many other conditions that intertwines with the cardiovascular illness.
We are now moving from teaching a child, which is extremely important, to teach a family.
Dr. Fuster, in his career, is a prime example that you could be innovative and you keep changing your innovation based on the science, based on the need of the time.
We are going to start a project which has much more granularity than what we have learned thus far.
This project is an expansion of this understanding that they learned with Familia Project in Harlem, with the expansion in the 5 boroughs.
What links a project in Kenya, in Colombia, in Spain, in the island of Grenada, in Harlem, New York? They are all human beings, and I can tell you this is what links them.
It seems very clear to all of you that education is number one, isn't it?
Yes.
Much more difficult to change habits in adults.
Why I am in Grenada is because one of the critical issues is that the discrepancies that you see in the world we live is something that somehow is unacceptable.
Study shows a daily pill that combines cholesterol and blood pressure medicines taken with a low-dose aspirin cuts heart risks by nearly 1/3.
We see patients with heart attacks, and only about 25 to 30% take the medications that they have to take. Once I learned that only 25-30% of people are taking the medications given, the next question is why 70% don't. So this led me about 14 years ago to think about a poly pill, a pill that has everything that is needed in patients with heart attacks.
Dr. Fuster pioneered the development of the poly pill, which is a simple concept. The more pills they are prescribed with, the less adherent they are to these medications. He made the analogy with HIV, where it was shown that there's 3 different pills that the patient have to take when they have HIV, and when they were put together into one single pill, adherence to the medication was increased.
I'm very proud about this project. Maybe I'm more proud that took the resilience of going to answer a question that took 14 years. And at the end you say, you made it.
I want to congratulate you, Valentí, for a whole life dedicated to medicine and research. Gràcies per portar el nom de Catalunya tan lluny i ser un exemple del potencial de la ciència i la recerca al nostre país.
From Catalonia, from Spain, we admire, we recognize and express our gratitude
to Dr. Valentín Fuster. Thank you very much, amic Dr. Valentín Fuster. Moltíssimes gràcies.
Benvolgut amic Valentí. Com a alcalde de Barcelona vull fer-te arribar la meva felicitació per aquest merescut homenatge. Gràcies pel teu compromís i la teva feina incansable a favor de la salut de tots i de totes, visquin on visquin, de Barcelona fins a Nova York.
How do you motivate people? You don't motivate people through pure science. You motivate people through the heart.
In life, we may contribute an inch. The question, what is my inch, is trying to prevent cardiovascular disease worldwide. And it's a challenge in every place you go. I think this can be accomplished, though. It may take many years, but we may contribute a little bit.